Okay, good afternoon, ladies and gentlemen. I am happy to present to you on this global conference work that we did with my colleagues Martin Senoga, Professor Frank Mugaga, and Dr. Daniel Nadomi. And we focused on the susceptibility of persons with disabilities to landslides. After that, we also looked at their resilience, and then also did work on how these people are coping to the landslides that are taking place, that are being experienced in the Mount Elgon areas in eastern Uganda. And the work is, part of the work is already published with 2 papers, as you can see the drawing. And we thank the support of National Union of Persons with Disabilities and Norwegian Association of the Disabled, Victoria University, and Makerere University. We all know that the climate-induced hazards, especially landslides, floods, and others are on an increasing trend, especially in the equatorial region where Uganda is located. This has increased occurrence of fatalities and also risk posed to the person with disabilities because they are unable to escape in times of shocks, but also being assisted by the different people who are also running for their lives. Therefore, studies like this are important in benchmarking and triggering policy, especially fostering the inclusion of persons with disabilities to disaster risk reduction, but also disaster risk management in the face of hazards in Africa and Uganda in particular. Many people who have done studies in disasters, especially landslides in the area of study, but these ones have been focusing on other things or other concepts, especially scholars that have concentrated on the concentration and the susceptibility of different areas, maybe I can say sites in the mountain to landslides. Others have looked at how they can reuse the landslide scars without necessarily focusing on the susceptibility or the risk of persons with disabilities to landslides. And yet, Mount Elgon records the highest number of persons with disabilities, especially in the sub-county of Bushika. Persons with disabilities are most affected due to, first of all, the inaccessibility because of the terrain of the place, but also the failure to receive inclusive early warning information. Some of them receive information when it is already distorted due to communication problems. Others don't receive it at all. And when it comes to times of recovery and rescue, persons with disabilities are seldom included in these programs, making them very, very vulnerable and susceptible to landslide losses as a result of these shocks and crises. Therefore, the study was looking at assessing, first of all, monitoring and showing the risk of persons with disabilities to landslides based on the terrain parameters, but also assessing their level of resilience to landslides, as well as looking at how they are coping to landslides in the area. The general objective was to provide information crucial in building the resilience of persons with disabilities in the catchment, and that's the Manafa catchment where Bushika sub-county lies. And also the specific objectives were specifically looking at mapping out the susceptibility of the locations of persons with disabilities, assessing their level of resilience, as well as exploring the mechanisms they are going to use during building their resilience. So our study was conceptualized and based on 4 functioning components of improving resilience of persons with disabilities. The first one is the level of risk exposure of an individual person with disabilities, the housing infrastructure, the person's functioning capacity, and the socioeconomic resilience. All these ones combined together can either reduce the resilience of a person with disabilities or increase the resilience of persons with disabilities. So the study area is located in a mountainous area with rugged terrain and receiving high levels of landslide occurrences as depicted in figure 3.1. So the methodology in implementing the study was through field surveys and also measurements and also mapping the landslides, both visiting the secondary data as well as visiting the field as depicted in the picture when one of the researchers was carrying out an interview. We also used the digital elevation model with the help of ArcMap to generate and process the different terrain factors that underpin landslides in the area, as also reported by the different scholars. When you look at the results on susceptibility of persons with disabilities landslides, we see that majority of the persons with disabilities were living in altitude that is between 1,400 to 1,700, which are mentioned and underscored by different scholars in the area to be very highly and so disastrous when it comes to occurrence of landslides. The slope aspect, majority were also living on slope aspects south and then east and also southwestern facing hill slopes, which are exposed to high durations of sunshine and therefore weathering that promote mass wasting in the area, making them susceptible to landslide occurrence. And then when you come to the slope gradient, majority still 56% were living in a range that is marked as highly susceptible to landslides. When you look at the stream power index, or the ability of the streams to be erosive and cause floods as well as mudslides, we see that majority of the persons with disabilities still lived in hotspot areas that are so susceptible to massive erosion and mudslides, making their households be susceptible to landslides. When you look at the hill slope positions, majority of the persons with disabilities live on a mentioned hill slope that is very high, that is of very high risk, and that is the middle slope. Some people call it the straight slope, and this is where a majority of the landslides do occur in the area, making them highly susceptible to landslides. When we went to the second objective that was looking at the disability which is perceived to be most affected by the landslides, responses depicted that the blind people are highly affected by landslides, followed by the deaf-blind people, maybe due to the fact that they are unable to see where to run to, and also hear in case of early warning sounds in case of cracks, because before a landslide occurs, normally there has to be some sound that warns them that, guys, this part of the hill slope is gonna flow down slope. Then these ones who don't see are unable to move to evacuation centers that are designated in the area, such as the school premises, the churches, and the sub-county grounds. When you look at resilience of persons with disabilities in line with in village functioning capacity, it was recorded as low because majority of the persons with disabilities were at least having difficulties where one was at least two difficulties, and of which one was recorded to be unable to like someone would not be able to perform anything because of that difficulty. So majority of them were recorded to be very low in terms of functioning capacity. They could not help themselves in times of crisis. When it comes to socioeconomic resilience, we see that persons with disabilities still, when you look at the Kelder's scale of measuring socioeconomic resilience, they were also low. Majority, 41% of the persons with disabilities had low socioeconomic resilience. And we all know that in times of danger, It is the social capital, it is the economic assets that help us to come out of the danger, especially during recovery and aftermath of the disasters. When you look at the housing infrastructure as a component of assessing resilience, persons with disabilities scored very low compared to the needed one. We see that they have a geometric mean of 1.2, which indicated low overall infrastructure resilience. So the overall resilience of our persons with disabilities was recorded as 1.5, depicting low resilience as classified by Kelda's classification of resilience, as well as the Center for Disability, University of Sydney, depicting that there is a need of action to improve the resilience of persons with disabilities. When you look at the being used to boost resilience by persons with disabilities, we realize that majority are using relocation method here, and the other followed by self-help groups. But when you look at how they perceive these mechanisms that they are using to boost resilience, instead turns out that the self-help groups have the highest scores compared to the relocation. Yet it would be the method which is highly used can score the highest mark when it comes to effectiveness. Therefore, it was scored that the self-help groups are highly effective, also effective when it comes to boosting the resilience of persons with disabilities in Mount Elgon area. So in conclusion, persons with disabilities live in risk areas with the blind and the deafblind perceived as most affected by landslides. Their level of resilience to landslide risks was very low. Therefore, even if persons with disabilities were employing infrastructure mechanisms, functioning assistive devices, it is depicted that socioeconomic mechanisms such as self-help groups were perceived to be most effective in enhancing the overall disaster resilience towards the landslide. So the study recommends policy interventions as well as additional research. Under the policy interventions, recommend that the blind and deafblind people or persons in high locations to landslides can be prioritized for relocation to safer areas. But this can be done within the sub-county or the areas of their origin, because if you took them outside the areas of their origin, they tend to come back to the areas of their origin due to the social cohesion as well as need to interact with their families. Persons with disabilities are further encouraged to form or join self-help groups, because we realized that these are so crucial when it comes to building the resilience towards the landslide disasters. So we also recommended the institutions such as the Office of the Prime Minister and other offices that are in charge of resettlement to prioritize persons with disabilities when it comes to not only resettlement, but also trainings they give to the community, especially communities that live in highly prone disaster risk areas. So we recommended for additional research where we say that related studies on the resilience of persons with disabilities can be extended to other landslide prone areas, since the scope of the study was limited to Bushika, just a sub-county in Mount Elgon. And this was also still hampered by the scope owing to the COVID-19 restrictions. Besides landslides, people could also do research in disaster risk reduction in the face of disability, targeting other geohazards, including floods, including famine, and other hazards. Then further research could be conducted to establish the effectiveness of these self-help groups that we see being pointed out to contribute significantly resilience among persons with disabilities in this area. Thank you for listening, and that has been my presentation.